So I like all the energy in the crowd. A lot of people told me there's a lot of good networking time, so that's really good. Welcome back from our working session afternoon. So now we're in our working session readout. Again, this will be rough. It's just going to be, we're going to go through the three facilitated teams, and they're going to report out what they learned and the themes and potential next steps. And then we'll wrap this up. We're going to have Martin say a few final words. So without any other delay, I'm going to hand this over to Tim. Yep.
All right, so we had 3 hours of discussion with 4 minutes of putting together slides. So what you're about to read may not necessarily reflect all of the comments, but we'll make sure that we get them. Where's the? Why don't you do that? So the question was, what can suppliers do to support the pharma raw material supplies reliability and security? So what we did is we did a brainstorm on what does reliability mean, and what do we need to do from a reliability standpoint and from a security standpoint. So for reliability, it's about material quality consistency, making sure that you get the same material time after time after time. Order, on-time delivery, and forecast accuracy are two of the big key drivers. Documentation, which includes, for instance, C of A's and some other things. And we'll get into some of the other things that we're proposing with regard to more standardization and consistency. Continuous investment in processes. This was one where the comment was around you can't only do continuous improvement during good times. When things aren't going so well for the company or for the operation, you have to invest in this for the long term and not pick and choose when you're going to do it based upon profitability or anything else. Decrease complexity to improved robustness, transparency, which we'll talk about, second sourcing or second site, regulated over non-regulated materials. There are a lot of companies that are using non-regulated materials which don't have the consistency or quality potentially of the regulated materials. The manufacturer-supplier relationship at the functional level. This was a consistent theme. The relationship in and of itself can create reliability because you have trust, respect, and you're working together as a team as opposed to the hammer and the mole or whatever the game is at the fair. Whack-a-mole.
Or throwing over the fence kind of an attitude.
The parent-child lot information where you make sure basically that you really understand the parent lot can help reliability as well, so you're not using product that you've had a previous NC on due to product issues where you have the risk of doing it again. And lot diversification. So strategies around how to manage how to manage your lots can also increase the reliability of the supply. From a security standpoint, it's customer and supplier relationship again to foster transparency. The right product, secure through overt and covert measures. I think this was Tim. Okay, so the secure overt and covert measures that can be used to make sure that you're not getting the wrong product from an adulteration standpoint. Control and chain of custody, so understanding the entire supply chain, whether it's tier 1, 2, 3 suppliers all the way back, as well as freight, as well as where they store the product to make sure that there's a complete chain of custody all the way through the supply chain. Tamper-evident packing, expected quality over time. Again, I think we talked about this one. Intellectual property. That's not that's something that was brought up that we have to watch out for as we do the. I'm sorry. This was not intellectual property to the customer. This is making sure we don't lose intellectual property to people who want to do bad things. Freight management, security and access control. This is more kind of to Martin's discussion today about what happened in Connecticut. And then scrapping and disposable procedures. There's some materials, secondary packaging, and some other products that you do not want to throw in the trash can and have somebody go through the trash and get your product. To some extent, it can be more dangerous to lose the packaging than the actual drug because of counterfeiting issues. So what are the best practices and what are we doing to, what do we need to do as an industry? So we kind of bucketed this into three groups. Install foolproof and unique identification processes, audits and documentation, and systems and communication. So tamper evident, watermarks, photo libraries, identity testing, RFID are some of the things that to make sure that we're getting the product that we want to get. Through audits and documentation, we'll talk about this in a slide here in a second, but change controls, business continuity, specification approval, chain of custody, quality agreements, supplier change notifications, and product dossiers, and we'll talk about what the teams actually all pretty much came to the same consensus on the need to really make these more consistent and universal across the industry. And then systems and communication, so electronic records and trail of raw materials, almost serialization-ish. Handling locations and there's the first typo. Advanced shipping notifications, monitoring the end-to-end supply chain and variability, really understanding causes and sources of variability and what to do about it to make processes more robust. Supply chain mapping, I think that's going to be actually a topic for one of the other working sessions that readouts. Inventory management, end-to-end inventory management, and visibility across the whole network, suppliers, customers, and so on, and also some comments that needs to include equipment strategies, not just raw material strategies, because you can have all the raw materials, but if equipment breaks down and it takes 6 months to replace, it doesn't really help. And then testing. So testing optimization, I think, was one of the key themes in terms of what can we do end-to-end to optimize testing, but also make sure that processes are robust enough to avoid any issues with contamination or adulteration. So there's a bunch of questions that were raised, just that were interesting that we wanted to capture and things that need to be answered. How does the industry remain efficient without significantly increasing costs and burdening the system? We have a few proposals of what we can do on that, but that's something that we need to keep in mind. How can we assist implementation to avoid one-off or unique requests for light problems and drive standardization to help suppliers? We'll talk about that in the next and final slide. How far back in the supply chain should we go for supply chain mapping? Do we want to create an industry standard for that so that suppliers have a very clear path forward in terms of what they need? Or is it going to be every manufacturer for themselves to determine that? And, you know, do you need to go to the palm tree, or is getting things to make sure you're from an adulteration and a supply chain standpoint that you have the sufficient visibility? There's a question on what is a raw material and what's critical versus non-critical, and I think that's not really answered. You can say it's anything on a bomb until you realize that there's stuff that's not on bombs that are raw materials, and so what is a raw material was one of the questions. Suppliers should apply the same management style with their suppliers that manufacturers put on you, and that was actually from a security standpoint. How can we make the process more secure? And if the comment was, if you as a supplier are taking the same things that the manufacturers are putting on you and putting those on your suppliers, we're going to have a much more robust end-to-end system. How to work with problem suppliers that may not fall into these boats, or very small suppliers, or suppliers that just don't care about you, because you may be 0.01% of their business, and they're not going to create a custom process for you. If you go away, it doesn't matter to them, but you don't necessarily have a choice with second sourcing, or maybe they provide a unique material that nobody else provides. And then, as we mentioned earlier, protection of intellectual property to outside threats. So those were some of the questions that were raised. So in terms of the opportunities of Rx-360, we talked a lot during this discussion about what can be standardized across the industry to help suppliers, help us, and make things faster. And we created a list. One is product dossiers. to be able to have much more accessible information, and we are in the age of the internet, and we can do things via the web and through other systems that weren't available 20 years ago that we can better leverage. Change control definitions. What is a change control? When do you report? When do you not report? Some companies want you to over-report. Some companies want you not to report those things, and that was a common theme today as well. What is a change control, and can we try to standardize that through this initiative? Business continuity requirements. I think the definitions on each manufacturer probably has a slightly different, if not greatly different, definition of business continuity. And is there things we can do as a industry to not only come up with the definition, but also when we start sending out questionnaires and all these other things, are there things we can do to streamline those and make those more common, so that we're not giving suppliers 50 different formats to fill out the same thing over and over and over? That can be very confusing to do. Standardization of analytical systems for testing. This was more for identity testing of product on incoming. It's probably going to apply more to chemicals and media. C of A's, we had a good discussion in the third breakout session about the C of A's, and can we standardize the classification statements on the C of A's? Can we standardize the expiry date format and some other things with regard to the C of A's, as well as the parent lot information? Shelf life management. Suppliers were saying that some customers want 80% of the life, some customers want other things, and I don't know that that's going to be an opportunity to standardize, but it was a discussion point for some of the suppliers. And specification approval alignment. How can we utilize web-based applications and electronic data to provide real-time and accurate information is another one. So those are the 7 items that were identified as things that they felt that the industry, the Rx-360 could have some influence on in terms of trying to influence standards. Global standardization of materials, JP, EP, USB, for examples. What was the comment there?
Yeah, well, the point here was that a lot of, given that we're all doing business in different geographies, there are different requirements, and we as suppliers have to go through global compendia, each of which is different. I mean, JP is different than USB and EP. So, is there a way to standardize that?
The next one is, how can Rx-360 help smaller suppliers? So there was a comment or comments that, yeah, this all sounds really good if you're a really big supplier and have a lot of money and resources and so on, but there's not, every company doesn't fall within that boat. And how can Rx-360 also help the smaller suppliers to get on board as well without overburdening them with resources and costs? The next comment was interesting. If we are truly trying to drive standards, how can you do that unless you have more participation in Rx-360 through more suppliers, through more customers, manufacturers? So there needs to be a drive really to increase this audience by more suppliers and more manufacturers if we're really going to try to drive change across the industry. Kind of to the point around the smaller suppliers, we need qualification and incorporation of Tier 3 and Tier 2 and 3 suppliers. And then I think we talked about the transparency. How far back do you really need to go to stay efficient but still get everything you need from an adulteration supply chain standpoint? Questions? Are we taking questions, or is that it? I doubt it. And with that, we will hand it over to Debbie Holler, who's going to do question 2.
I don't need this. Turn it off. Hi. So, give me 1 second here. We're not as fancy with our slides. Tim, that was a good job. So our topic was talking about collaboration, right? And I'm just going to hit on some of the major points here. Not written out in full sentences, but all of you were in the session, so you'll kind of get the gist of it. What was interesting is things came up about standardizing. That came across on a couple of different points, and we'll come to those. But like the Earth to Patient initiative, is there the opportunity to kind of do this transparency, this mapping of the full entire supply chain within the community of Rx-360? There was some passion and interest around that. There was a lot of discussion in each of the sessions talking about knowledge sharing and collaboration within the membership organizations of Rx-360, specifically talking about maybe there's a way to take and talk about lessons learned or bring up a topic, maybe have some education around some kind of high-level items that are of interest of people, and they'd like to have more in-depth discussion around those. Talk about total cost of ownership and using that as a setting standards and leveraging that with suppliers. And again, collective intelligence sharing. This was a really interesting discussion because the discussion went around the idea of, do we have the opportunity, can we open up and share openly about what's happening on a topic such as cargo theft? Still maybe protect the companies that are affected, but take it a step further and talk about, okay, lessons learned. What did you do to your supply chain? How can we share that information collectively amongst the organizations? And then a couple of other points I'll just hit on real quickly. There was an interest to have a ready pool of experts from Rx-360 so that subject matter experts could be kind of a pool that people could reach out to and say, hey, I have an issue with this. Is there someone that can help weigh in on this for me as part of my membership in Rx-360? They talked about I believe the term is flash alerts. And currently we get those and those are sent out, but they'd like to actually mature that or enhance it more so it's more collaborative. If there's a flash alert, give more detail. Maybe actually it extends, and this kind of steps into the boundaries of social media, if you will. But is it something that can be shared via a blog or that sort of thing amongst that membership of Rx-360? And I will say we were very open. We were brainstorming on ideas, and I encouraged the candid conversation, so I'll bring up the topic. They talked about the audits and the Rx-360 audits and making sure that, if we're part of Rx-360 and we're sharing and we have a standardized audit, let's make sure that those are accepted across the companies. So those are some of the high-level points, the ones that were kind of got the top votes, if you will. We do have on the last page, and I'm sure this will go out in some format, but we have the entire list of kind of the conversation, which is broken down between kind of the topics, maybe some ideas of some possible solutions, and also some general questions like what Tim had in his session. So that's it. Any questions? No? I think that's it for slides.
Okay. Group 3. My name is Rob Welsh. I'm with VWR, and my colleague Bretta Lichtenhan from EMD Millipore, who we serve together on the Rx-360 Upstream Supply Chain Committee. We put this together. We're very informal. I just have some talking points from written notes, and I'll get something more formal. We were so involved in the dialogue, and I appreciate all the open dialogue that took place during our session. So I'll try to hit the high points. Really, and the question really was, what are best practices in supply chain transparency and monitoring in our industry? And it was actually at the start of one of the groups, it was turned around in a good way, and it was really turned around and says, what inhibits fostering transparency? And it really came down to two key points. One is trust. And that's where, I think it was talked earlier in the morning about the need to have a partnership between the supplier and the manufacturer, so that there's that trust about sharing information. And then the second concern that was brought up was, concerns around proprietary information. So how do you kind of break down those barriers so that we're able to share the information that's needed to be effective together? So, and I thought a good analogy was brought up around the Coca-Cola bottle. Where it's not only Coca-Cola, but quite frankly any food product, you see the ingredients readily listed on the product. So it really needs to be kind of broken down to three areas as far as need to know, what's the legitimate requirement to need to know, and what's the scope of the inquiry, to kind of put some fences around on what information needs to be shared to be effective as far as creating that transparency. Education, and education on why there is a need to know. And I think one of the things that we took away being involved in the committee is there an opportunity for us to help create some kind of tools that can be used by not only pharmaceutical manufacturers but suppliers, so that we're able to effectively educate our supply base on why this is really important around the transparency issue. So that was a key takeaway to kind of develop. And then, the third thing is, just working through whatever legal protections need to be addressed, CDAs, et cetera, from that standpoint. A key point of emphasis and really an area of opportunity was looking for E-enabled solutions. There are some technology that's being used today. I think it was mentioned by Tim, ASNs. So ASNs is a good example of a common practice. We're trying to get more standardized, that's what's expected, and not only ASNs, but ASNs, say, with lot information, so that there's able to create that visibility. But there was a talk around other means of creating B2B connectivity, and as it relates to, are there certain industry standards that could be tapped into? ASME standards, BPE standards, that were kind of looked at, and for us to benchmark, and we'll look to do that as a committee to investigate. So another good comment was around alignment of metrics between procurement and the manufacturer, and I think that was important in terms of to foster that partnership with the supplier. A lot of it's about not only what the cost is in terms of your driving, but how do you create value through that process. So, and education just came over and over, and that's a key takeaway we're going to have as a committee. And the example on E-enabled tools, I think it was kind of an interesting one. And there's a lot we can learn from other industries. The food industry I referenced before, but also one of the examples that was brought up, it's a new industry, which is the marijuana industry, both medical and for recreational use, where plants are actually barcoded, so that there's actually that level of transparency down back to the plant. So what can we learn from other industries? And I think that's something we need to do from the best demonstrated practice. And then, just in summary, it's all about sharing controls through defined measures. And I thought that was a good summary comment that came out of one of the sessions on kind of how to, it's all about, shared controls through defined measures, and how do we work collaboratively together to accomplish that and foster that transparency that our patients deserve, and that we really need, our end customer from that standpoint. So, Bretta or anyone else, is there anything we missed? Okay. Any comments, questions? Okay, and I'll get something more formal. Thanks.